Did you know that acne affects 50 million Americans every year? It's the most common reason why teenagers see a dermatologist, and the third most common reason why adults do. Your face is the most important part of you. It's what you present to the world. Having acne can really wreck how you feel about yourself and feel around other people. Face it, having acne makes you feel like something is wrong with you. But is it really? Understanding what acne is and what you can do to help yourself is important to a happier, well-informed, and dignified life. Let's talk about the best ways to get your point across to doctors about your acne. Self-care strategies, what you need to know about acne medicines, and what you can do to help fix acne scars. Maybe someone, even a doctor, told you that your acne isn't bad enough to see a dermatologist. Maybe seeing one feels too much of a big deal or too costly because of health insurance dramas. Or maybe one chilly doctor visit made you think, nope, I'm done with this. Believe it or not, a lot of people with acne feel this way. A 2021 study in the medical journal BMJ Open found that many adults with acne feel like their doctors don't take them seriously. When that happens, people can lose trust in regular health care. Some start trying alternative treatments or online skincare hacks. But some of those fixes can still leave them frustrated when they don't get to the results they seek or the real cause of their problem. Education about acne. Learning about acne can help you feel more in charge of your skin. It can also help you talk with your healthcare providers, like your regular doctor, a nurse practitioner, or dermatologist, without feeling lost. When you know what to expect and how to speak up, it's much easier to get the care you actually need. Acne is a common skin problem. It usually happens when three things team up. Your skin makes too much oil, old skin cells clog up hair follicles, and a normal skin bacterium called Cutibacterium acnes grows more than it should. Importantly, acne is not contagious. It isn't some creepy infection. It's not happening because you like fish and chips or fried chicken wings or bang bang shrimp or even chocolate. You're not dirty and you're not infested. When too much of your natural skin oil, clogged hair follicles, and extra Cutibacterium acnes bacteria pile up together, blackheads and whiteheads can show up. Acne can also get red, swollen, and sore. That's called inflammatory acne. It can cause pus-filled pimples, deeper bumps called nodules, and cysts. A patient-centered dermatologist. If your acne is moderate or severe, it's smart to ask for a referral to a dermatologist. If you think hormones, your endocrine system, or your immune system might be part of the problem, you may also want to ask about seeing an endocrinologist. Do you need to go through your primary care provider first? No problem. Just be direct. Say, acne is affecting my quality of life. Please give me a referral to a dermatologist. Make sure that the provider refers you to a dermatologist or other specialist who is in your healthcare insurance network, so you can be assured that you'll be covered for at least some of the cost. A dermatologist can check your skin to make sure that you have acne and not another skin condition, or acne plus another skin condition. Getting the right diagnosis matters a lot. It can save you time, money, and a whole lot of why isn't this treatment working? Once you have a diagnosis and start treatment, give it time to work. Acne doesn't heal overnight. It usually takes patience, good skin care, and the right medicine and clear instructions. A good dermatologist should talk with you about your skin goals and how acne is affecting your life. Then you can make a plan together that fits your needs. This is called patient-centered care and shared decision-making. Before your visit, think about what skincare and medication routine would most fit your lifestyle and preferences. What kind of skincare routine can you follow without getting bored or giving up? What kind of medications and procedures do you feel comfortable trying and which do you have questions about? Should you change your diet or lifestyle? Which over-the-counter products or supplements should you try? What about natural and alternative products? Helpful or just a money trap? Write down your questions before your appointment so you don't forget them. Resist an "I know better" attitude, though. Remember that your healthcare provider is an educated and skilled expert, or should be. You should be doing your part to ask the right questions, though. Ask for patient education. Be clear about your symptoms and your stress about your symptoms. Be honest with yourself and your provider about what kinds of medical treatments and lifestyle changes you feel would be easiest to follow. Acne treatment can take a while, especially if your acne is severe. It's easy to get tired of the routine when you don't see fast results. You may want to skip steps or quit altogether, but ditching the plan can make your acne worse. Once your treatment plan starts, try your best to stick with it. Whether you're using something from the drugstore or a prescription from your doctor, give it time to work. Don't bounce from one product to another every week. That can annoy your skin and make things worse. Stick with one product for 6 to 8 weeks before you decide if it's helping. Also be honest with your dermatologist or care provider about how it's going and what other do-it-yourself things you are doing to manage and heal your acne. Your feedback can help your dermatologist adjust your plan as needed. Here it is. These are acne skincare tips based on advice from the American Academy of Dermatology. Gently wash your face twice a day and wash again after you sweat. Use your hands and a gentle cleanser to wash your face. Skip the washcloth, sponge, scrubby, or any other gadget. Scrubbing your skin clean will just irritate your already irritated skin. Also, more is not better. Washing too much can dry out your skin. For most people, twice a day is enough. Wash your hair often enough so extra oil from your hair and scalp doesn't end up on your face. Use gentle skin and hair products. Look for words like alcohol-free, non-comedogenic, or won't clog pores. Skip harsh toners, scrubs, and astringents. They can dry out your skin and make your acne look worse. Use a moisturizer that is gentle and made for sensitive acne-prone skin. Put it on after you wash and gently dry your skin while your skin is still moist. Try not to tan and protect your skin from sunburn. Use a water-resistant sunscreen that is SPF 30 or higher. Look for one that says non-comedogenic or won't clog pores. If you wear makeup, choose products that say non-comedogenic, won't clog pores, or hypoallergenic. You know the buzzwords. Don't share makeup brushes or applicators. They can spread oil and dead skin and germs. Also, make a habit of removing makeup and washing your face at the end of the day when you're ready to hit the hay. You may want to attract the hottie across the room, but it's wise to remove makeup before hitting the gym or otherwise working out, because you're going to sweat. Sweat, oil, and dead skin can clog pores. Blot sweat with a clean towel and wear clean workout clothes. And try not to share sports gear like helmets or pads with others. Watch your carb and sugar intake. Some research suggests that the more carbs you eat, the worse your acne may get. Rather than fad and restrictive diets, though, focus on making healthy but satisfying food choices. We won't get into the nitty-gritty about diet today, but you must have heard the news like a broken record by now. A good diet is when rich in leafy greens and other vegetables, lean meat, and whole grains. And just like your mom said, stop touching your face and don't pink your pimples, you'll make it worse. What's your acne journey been like? Let me know in the comments, and help the algorithm by liking, sharing, and subscribing to this channel. Want to feel more prepared when you talk to your primary care provider or a dermatologist about acne? It helps to know what treatments are out there and what they're supposed to do. This isn't about second-guessing your doctor. It's about walking in with a little insider knowledge so you can help make smart choices together. Remember that a team approach, shared decision-making, is important and goes hand in hand with patient-centered care. And patient-centered care means that your needs, goals, and real life matter. If your acne is mild, good skincare habits and over-the-counter products may be enough. If your acne is moderate or severe, it's a good idea to have a dermatologist on your team. They can figure out what's really going on, prescribe medicine if needed, and keep an eye on your progress. Common prescription acne medicines include topical retinoids, which are vitamin A creams or gels, the oral retinoid isotretinoin, antibiotics you put on your skin or take by mouth, and hormone-related medicines. Topical retinoids come as lotions, creams, foams, or gels. Topical means it's a medicine meant to be put on your skin. Studies have shown that topical retinoids can be safe and effective. Which one is the best for you depends on what your healthcare provider thinks works best, and what your skin can handle, and what's easy for you and what you can afford. So yes, ask about safety, side effects, and how to use the recommended medication. Also ask about cost and insurance coverage. Isotretinoin is also available in a pill form. This medicine is often the big gun for acne. It's usually safe for severe acne or acne that hasn't improved with other treatments. Antibiotics for acne can be creams, gels, or pills. They help control extra Cutibacterium acnes bacteria and other germs and calm down red, swollen acne, including pustules and cysts. Doctors often pair antibiotics with other acne medicines. Hormone therapy and anti-androgens. If you're a woman, hormone therapy might be an option if your doctor thinks hormone changes are fueling your acne flares. Some birth control pills that contain estrogen and progestin can help because they lower the effect of acne-triggering hormones called androgens. Other anti-androgen medicines used for acne include spironolactone, a diuretic that seems to work decently for acne caused by overactive androgens in women, and a new cream called clascoterone that is a straightforward anti-androgen medication. More than anything else, acne scars are probably the hardest to cope with. If you have them, you're not alone. Nearly 50% of people with acne have scarred faces. Boys and men are more vulnerable to getting acne scars than are girls and women. But the worse your acne, the greater your chances that you will end up with scarring. Getting rid of acne scars can be complicated because they take different forms and different things are happening in the skin that result in scarring. Skin repair treatments include laser-based treatments, microneedling, chemical peels, and fillers. Different lasers and laser techniques are used according to the type of scarring you have. Some lasers vaporize damaged skin, others promote collagen growth. Both types might be used together to heal acne scars. The technology has good success, but when discussing laser surgery with your dermatologist, talk about the possible side effects and complications that can occur. A good dermatologist will automatically go over the pros and cons, including possible side effects of laser surgery. They will also have a plan of action ready if a side effect occurs. Microneedling is a technique that uses fine needles to make tiny holes in the skin. This wounding is done to stimulate the skin's healing abilities. Collagen and elastin are produced and come to the rescue for skin rebuilding, forcing the skin to heal itself. In this way helps improve wrinkles, fine lines, wounds, and yes, pimples. Chemical peels involve treating the skin with products that remove old skin cells and debris from the skin surface, and may even remove top layers of skin. Again, removing skin, which is causing a kind of wound, stimulates your body to make fresh, new, healthy skin. The type of chemical peel you will need depends on your skin type and severity of your acne, and the type of acne scarring you are dealing with. A combination of chemical peel products are sometimes used to get the benefit of their different effects. Dermal fillers fill in areas where scarring has made the skin pitted and uneven. The safe use and effectiveness of dermal fillers will depend on the type of filler used, the expertise of the dermatologist treating you, and your skin acne and scar types. Dermabrasion literally involves sandpapering your skin using a special sandpaper and hydrogen peroxide or special motorized skin sanding gadget. Again, the idea is to remove damaged top layers of skin, which will force the skin to create collagen and new, fresh, healthy skin. Silicone patches are safe and effective solutions for treating thick, raised acne scars. Pressure and moisture counteract and reverse the unwanted buildup of collagen and other types of skin cells that form the scar. The problem is that most people do not want to be wearing silicone patches all over their face. Again, an informed chat with a dermatologist about how to win the battle against acne scars can make a big difference in healing your skin and your life. What can you do to feel attractive, strong, confident, and resilient, even if you don't, because of acne? You might consider ways to change your mind. Being educated about your skin condition, feeling not alone, and feeling compassion for yourself can go a long way. There are lots of resources available that can help you develop self-acceptance and resilience. Studies show that cognitive behavioral therapy and mindfulness-based therapy can help you handle the stress that can come with acne. Cognitive behavioral therapy can usually be completed in as little as 5 sessions to up to 20 sessions with a trained therapist. And mindfulness training is something that is often offered for free through different organizations. Mindfulness involves learning to notice your usual thoughts and feelings without getting stuck in them. Instead of acting on autopilot or else overthinking, you learn to pause, take a breath, and choose a kinder, healthier, and more skillful way to think and act. Mindful-based hypnotherapy is another option that has shown success in helping people overcome negative feelings about themselves because of acne. Hypnotherapy can even sometimes help with symptom relief. A good hypnotherapist can also train you in self-hypnosis techniques that can help you be more resilient, less stressed, and healthier in mind and body. Do you want a deeper dive into acne, including skin problems that look like acne and polycystic ovary syndrome, or PCOS, more on how to keep it together and have a great life despite acne, and the short list on top-notch, hack-free, quack-free patient education web pages on acne care? It's all in this comprehensive booklet, available as an ebook and paper book on Amazon. If this information was helpful for you, like, share, and subscribe. Thank you.